If you've ever heard this claim, you need to ejaculate 21 times a month to protect your prostate, pause for a second and take a breath. Because the truth is not a magic number. But there is a smart way to think about ejaculation and prostate health, and most men get it backwards. They obsess over the count, while ignoring the real drivers of prostate problems. In the next few minutes, I'm going to show you what the research actually suggests, what it does not prove, and a practical rhythm most men can use, without turning this into anxiety math. Quick question before we start. Are you worried about cancer, urination issues, or pelvic discomfort? Because those are three very different situations. And the right answer depends on which one you mean. When men ask, how often should I ejaculate to protect my prostate? They're usually worried about one of three things. 1, prostate cancer. 2, BPH, benign prostatic hyperplasia, meaning an enlarged prostate that can affect urination. 3, prostatitis, irritation or inflammation that can cause pelvic pain, pressure, or discomfort. Here's the key point. Those are not the same problem. So if your goal is prostate protection, you need a framework, not a rumor. And if you're thinking, okay, so what's the framework? Good. That's exactly what we're doing today. Let's kill 3 myths fast. Myth number 1, if I don't ejaculate regularly, toxins build up and I'll get cancer. Myth number 2, if I ejaculate often, I'm draining testosterone and weakening myself. Myth number 3, there's one perfect number that applies to every man. Real prostate health doesn't work like that. Your prostate isn't a scoreboard, it's a gland that responds to hormones, inflammation, blood flow, nervous system stress, and lifestyle. Ejaculation frequency is one small lever, not the whole machine. And the problem with the 21 times idea is it turns something that should be low stress and natural into a performance target. That alone can backfire. Now let's talk about where the 21 times a month number even came from. There was a large long-term observational study that found an association. Men who reported higher ejaculation frequency, around 21 or more times per month, were less likely to be diagnosed with prostate cancer later compared to men reporting 4 to 7 times per month. But I need you to hear this clearly. This does not prove that ejaculating more prevents prostate cancer. It does not mean every man should force himself to hit 21. And other research has been mixed, which is why major medical sources do not give a required number. So the right takeaway is not chase 21. The right takeaway is regular ejaculation may be associated with prostate benefits for some men, but it's not a guarantee and it's not the biggest factor controlling your risk. And here's a retention reality check. If anyone tells you there's one number that protects your prostate, they're oversimplifying a much bigger picture. So let's zoom out. So why would ejaculation possibly help at all? Think of the prostate like a gland that produces fluid, kind of like a little factory. One theory is a simple flush versus stagnation concept. When a gland produces fluid and that fluid sits for long periods, some men may experience more congestion or irritation. Ejaculation is one way that fluid gets released, like flushing a system. But here's the nuance most people miss, and this is the part that changes how you use the research. Higher ejaculation frequency may also be a marker of overall health. It can correlate with better sleep, better mood, better cardiovascular health, better relationships, less stress. So it's very possible that part of the benefit is not the ejaculation itself, but the healthier baseline that often comes with it. That's why forcing a number is the wrong strategy. Pattern interrupt question. If you're exhausted, stressed, sleeping 5 hours, not exercising, do you think hitting 21 fixes the foundation? No, it just gives you a new thing to worry about. So what should you do in real life? Here's the practical guidance I give men who want a reasonable rhythm. If you're healthy and comfortable, aim for a regular pattern that feels sustainable, often a few times per week. For many men, a simple baseline is 2 to 4 times per week. Why that range? Because it's realistic. It matches recovery for most men, and it avoids turning sex or masturbation into a stressful routine. Could it be less? Yes. Could it be more? Yes. If your natural rhythm is closer to daily, that can still be healthy. If your body is handling it well, no pain, no irritation, good recovery. Because again, the goal is not a number. The goal is good function, no pain, and no anxiety. Now, you might be thinking, okay, but how do I know if my body is handling it well? Good. Here's the check. Instead of obsessing over frequency, use this quick 3-signal check. Signal number 1. How does your pelvis feel afterward? Healthy pattern, no burning, no aching, no pelvic heaviness. If you consistently feel sore, irritated, or inflamed, that's your body giving you feedback. Signal number 2. How's your recovery and erection quality? If your erections feel stable and you recover well, great. If frequent ejaculation leaves you depleted, anxious, or erections worsen, scale back and fix the foundation. Sleep, stress, cardio fitness, blood pressure, blood sugar. Signal number 3. Is it in your control? If ejaculation becomes compulsive, disrupts your sleep, or increased anxiety, that's not prostate protection. That's your nervous system using a shortcut for stress relief. Pass those 3 checks and your frequency is probably fine. Mini summary so far: retention. No required number. A baseline like 2-4-week works for many, and your body's feedback matters more than the count. Now, let's build trust and talk about red flags. If you ever have blood in urine or semen, persistent pelvic pain, burning with urination, fever, chills, or severe discomfort, or rapidly worsening urinary symptoms, don't self-diagnose based on a YouTube comment section. That's when you need a real medical evaluation. Because protecting your prostate is not just about ejaculation. It's also about recognizing symptoms early and getting proper care. If you truly want to protect your prostate after 40, focus on the big levers. 1. Stop straining to urinate. Don't power void. Chronic pushing can irritate pelvic tissues over time. 2. Move your body. Walking, strength training, and cardio support blood flow and metabolic health, and that matters for prostate health too. 3. Sleep and stress control. Your nervous system and inflammation chemistry are not soft topics. They directly impact pelvic tension, hormonal signaling, and recovery. 4. Talk to your clinician about screening based on age and risk factors, especially if you have family history. Ejaculation can be part of the picture, but these are the pillars. So here's the real answer. There is no required number. Regular ejaculation may be associated with prostate benefits in some men, and a practical baseline that works well for many is 2 to 4 times per week, adjusting based on how your body responds. Now, in the next video, I'm going to answer the question men are afraid to ask out loud. How many times can you ejaculate in a day before it becomes too much? And I'll show you the signs your nervous system is driving the habit, not health. Subscribe, turn on notifications, and I'll see you in the next video. I'm Dr. Emily Carter.